So, if you see, the natural history of disease has two phases, that is, pre-pathogenesis phase and pathogenesis phase. The pre-pathogenesis phase, that is called the process in the environment. The pathogenesis phase is the process in the man. So pre-pathogenesis phase is the process in the environment. That is, it's a period preliminary to the onset of the disease in man. Disease agent has not yet entered man, not yet entered man. The agent not yet entered the man. That is, but the factors exist in the nature. The factors which favor its interaction with the human host are already existing in in the environment, in the nature. That is, man in the midst of disease, man exposed to the risk factor phrase, the phrase which describes the above sentence. Potentially, we are all in the pre-pathogenesis phase of many diseases, like communicable diseases and non-communicable diseases. We are in the pre-pathogenesis phase of many diseases. The development of the disease, like the pathogenesis of the disease, established in the individuals if the individual has low immunity or certain factors which favors the infectious agent or the disease to progress more. So potentially we are all in the pre-pathogenesis phase of many diseases. So once, for example, if not, so take the example of non-communicable disease. If we smoke more, if I smoke more, so I might get a chance, I might get MI, right? So I smoke daily, so I'm the pre-pathogenesis phase of many diseases. In future, I might get MI, atherosclerosis, etc., CVDs. So the meaning of this is that the causative factors of disease are agent, host, environment. They are interact with each other. The complex interaction between the agent, host, and environment. This is a concept of causation, that is epidemiological triad. So that, see here, the interaction of three factors is required to initiate the disease process in a man. In the pre-pathogenesis phase, see, agent, host, environment. This determines the onset of disease, distribution of disease in the community. The interaction should be there. Right? See, health promotion, specific protection, that is primary prevention, or the intervention measures can modify pre-pathogenesis phase. Example, health promotion. As I said earlier, I'm a chronic smoker. So if I am advised to stop smoking, or if I do stop smoking by some health promotion by some doctors, etc. So in the I'm the pre-pathogenesis phase, right? So I might don't get, like not get MI or CVDs, etc. diseases, right? Etc. non-communicable diseases or hypertension, for suppose. So these are intervention measures. They are intervening to stop that disease in the host, right? A specific protection. That is primary prevention. Prevention of the risk factor. Risk factor is smoking is a risk factor to the development of atherosclerosis, MICVs, right? So that's why the intervention measures in the pre-pathogenesis phase can modify the disease process. If we come to the pathogenesis phase, begins with the entry of the disease agent in the susceptible human host. After the entry of the host in the after the entry of the agent in the host, the pathogenesis phase starts. See the incubation period. The infectious agent has entered the human body, human host. So it incubates, incubation period. See, after the incubation, the early pathogenesis phase, late pathogenesis phase, and after the pathogenesis phase, it may heal or recover of the individual from the disease, or it can make the person or the host disability from that disease, or at last there can be death also. So this is progression. See, from here it progresses. The backward suggests healing. So this is progress. The disease may progress either ways. It can worsen or it can cure. See, the event in the pathogenesis phase, the events in the pathogenesis phase in infectious diseases. This is the events. So these are the events. that is incubation of the organism, that is agent has entered the human host. In this incubation, the agent is already present in the environment, it entered the human host, so the early pathogenesis phase starts. After that, late pathogenesis phase. After the pathogenesis phase, the recovery or disability death are the final outcomes. So here I explained the flowchart. The disease agent multiplies and induces tissue and physiological changes. So incubation period, the early pathogenesis and late pathogenesis. This overall comprises pathogenesis phase. So pre-symptomatic stage, in between you can see the pre-symptomatic stage. After the late pathogenesis phase of the pathogenesis phase, these are the final outcomes, that is, it can be death or disability or recovery. So the intervention measures are immunization, chemotherapy. For example, immunization. Polio, take example of the polio. If polio vaccine is given, it is an intervention to prevent the polio. And first, let's suppose TB. Intervention is a chemotherapy. See, this clinical, subclinical, typical or atypical infections. It comprises infections. Those are clinical or subclinical, typical or atypical also. See, host, carrier, with clinical manifestations, without clinical manifestations, can also be present. Right? The patient has infected with an infectious agent, but he is not at all developing any clinical manifestations. That doesn't mean that he is not has the disease. He has the disease, but he is a carrier. So the infection is subclinical. So see here the phases: pre-pathogenesis phase and early pathogenesis phase or late pathogenesis. This total comprises pathogenesis phase. Pathogenesis. See, the pre-pathogenesis agent, host, environment are present, but no interaction between them. Okay, after some time there will be interactions. So that is the starting point of the disease, right? So primary prevention is applied. These are the risk factors. To prevent this interaction, primary prevention is applied. And if, first of all, there is no prevention is there, the agent host environment are interacted and the disease has entered the host, so the pathogenesis phase starts. That is early pathogenesis, early stage of the disease, and it progresses to late pathogenesis, that is late stage of the disease. In between this early pathogenesis and late pathogenesis, there can be pre-symptomatic stage in chronic diseases. See, after the late pathogen phase, the outcome may be recovery, disability or death, or a carrier state. So these preventions, if we apply the primary prevention, if the primary prevention is applied at the pre-pathogenesis phase, that is at the initial stage of development of the disease, so we can prevent the occurrence of the disease in a host. So if secondary or screening is applied, secondary prevention is applied at the early pathogenesis phase, we can prevent the disease occurrence in the host. So the tertiary prevention applied at the late pathogenesis phase or in the pathogenesis phase, we can prevent the outcome of the disease.